In this video, we're going to talk about the basics of the motion of the spine. The spine can move in all three planes: sagittal, frontal, and transverse. The sagittal plane divides the body into right and left sections. Motion of the spine will be flexion and extension. The frontal plane divides the body into front and back sections. Motions would be lateral flexion to the right, lateral flexion to the left. And then finally, the transverse plane or horizontal plane, motion would be right or left spinal rotation. So motion of the body typically happens around axes, meaning it is primarily rotational motion rather than linear or straight motion. So if we look at the frontal plane first, since we already have a frontal plane view, I would have a series of anterior, posterior axes going through the spine. Each pair of vertebrae would have its own individual anterior-posterior axis. Also, as we go through motion, these axes are going to shift a little bit. They're not actually fixed in place. And they typically shift towards the angle of motion, which we'll see in a minute. So if I just pick a spot here for an anterior-posterior axis to analyze, if I then bend to the right, that would be right lateral flexion. And if I come back towards the left, that would be left lateral flexion. And those motions would be in the frontal plane around anterior posterior axes. If I start to laterally flex to the left, the axis tends to shift to the left. If I laterally flex to the right, the axis tends to shift a little bit to the right. And that shift happens because of compression of the disc and approximation of the vertebrae on that side. So if I approximate the lateral edges of the vertebrae on the right and distract the lateral edges of the vertebrae on the left, the end result is right lateral flexion. Then if we shift again, approximating the lateral surfaces of the vertebrae on the left, distracting the lateral surfaces on the right, then that is left lateral flexion. So if we look now at the sagittal plane would have the motions of flexion and extension around medial lateral axes. So again, each pair of vertebrae would have its own medial lateral axis. If I go into flexion, which would be an anterior motion in the sagittal plane, I would approximate the anterior surfaces of the vertebrae and in general would be distracting the posterior surfaces. If I go into extension in the sagittal plane around the medial lateral axes, I am approximating the posterior surfaces of the vertebrae and distracting the anterior surfaces. And all this motion is relative. I could have some compression along the entire disc between each vertebrae. As long as there is more compression in the back, there will be extension. As long as there is more compression anteriorly, I would have flexion. There is one exception to that rule, and that is if I go into full extension, I may shift that axis all the way out of the disc or past the disc into the facet joints themselves. If the medial lateral axis goes to the facet joints, as I get into or near full extension, I will actually distract a little bit of the disc in the anterior and posterior side. I'll just have more distraction anteriorly, a little bit less distraction posteriorly. So how it would typically look is if I start in a position of flexion and I start to extend, the axis shifts posteriorly. I start to compress the disc more posteriorly and decompress the disc anteriorly. But once that axis shifts all the way to the facet joints, I can get a little bit of decompression on the posterior side of the disc as well. And finally, we'll look at rotation in the transverse plane. So I would have right and left rotation along vertical axes. So the vertical axis would be approximately through here, although it would zigzag down the spine because of the curvature of the spine. So again, the axis or axes would not be directly stacked on each other, but there would be some variation as we move down the spine. So then within the transverse or horizontal plane, we would simply have right rotation and left rotation. And this is named from a superior to inferior bias. What I mean by that, if I had this motion, the pelvis is starting to turn to the right relative to the rest of the spine. And you could say the pelvis and inferior vertebrae are rotating right compared to the rest of the spine. But that means the superior portion of the spine is turning to or rotating to the left relative to the inferior part of the spine. So this indeed would be left spinal rotation. Again, if I start here, I rotate the superior vertebrae on the inferior vertebrae. That is left spinal rotation. If I rotate the inferior vertebrae underneath the superior vertebrae, where the pelvis starts to point to the right, it is still left spinal rotation. I end up in the same position I did before. Based on some of the general nomenclature for biomechanics, the superior vertebrae rotating on inferior vertebrae, this would be standard action left spinal rotation. And then this would be reverse action left spinal rotation. Then finally, we have some terms for muscles that are unique to the spine or muscle actions. So as we mentioned, we have left and right spinal rotation. But if I have a given muscle on the left that rotates to the left, and a given muscle on the right that rotates to the right, I can't really call the muscle or a left or right rotator because it would depend on what side it is. So instead we use the terms ipsilateral or same side rotator and contralateral or opposite side rotator. So the transversal spinalis group, which would include rotatories, semispinalis, and multifidus, would all be contralateral rotators. So they run approximately from the transverse processes inferiorly to the spinous processes superiorly. So when they contract, muscles on the left side would rotate the vertebrae to the right. So contralateral rotation. The muscles on the right side, when they contract within the transverse plane, would rotate to the left. So again, contralateral rotation. And we can look at that again here. So if we have a muscle more lateral inferior, more medial superiorly, when that contracts, if it looks like this, that is left rotation for a right side muscle, contralateral rotation. And then go to the other side, left side muscle, again, we're looking posteriorly, would rotate to the right, contralateral rotation. And then ipsilateral, the primary example would be internal oblique or a primary example. So internal oblique would be a ipsilateral, so the fibers run approximately this direction. So they're more lateral inferior, more medial superior. When they contract, it would rotate to the same side. So internal oblique would be an example of a ipsilateral rotator.